Okay, so this is the visual field machine. It tests for a patient's peripheral vision. To start, you're going to input their glasses prescription or their last manifest refraction into this. You always start with the right eye. So I have like a fake prescription here. So you're going to be putting the patient's glasses prescription or their last manifest refraction onto this. Here is where you'll get all your lenses. There's sphere positive, sphere negative, and then cylinder. So for this prescription, it's minus 2.5 sphere. So here's the minus 2.5 sphere. The prescription goes from back to front. So sphere will go in the back right here. It doesn't matter at which angle this is at. And then her sill is minus 2.5 at 84 degrees. For the sill, this is minus 2.5. And there are little lines on the edges right here. So you'll put the sill at the front and then line up the lines to 84, which is this way. Right around there. And then this will be for her right eye. So to start, you're going to look up the patient's last name or their patient ID. If they're not found here, you can add. An important step to remember is to change the ID right here from whatever is given in the machine to our personal patient ID number. If they're already in the system, you can just click. So once you click on the patient, all their information will come up right here. You can ignore this prescription part right here since we manually input it into that lens. And if you scroll down here, the test profile, 24-2 is the default setting that it's at. You're going to check in the assessment plan for the patient to find out what exact test they're doing. If it says HVF 24-2, you will do the 24-2 fast. Some of the other tests there are is the 10-2 standard, or there's also the superior 36, usually for Dr. Lee's patients. Right here you can decide if you want to do both eyes or if you're only doing one. For the superior 36, you're going to do right eye and left eye untaped, and then you'll repeat the whole test, right eye and left eye, and tape the lids up. For the other two, it's just one time on each eye. So after the patient's selected and you have the correct test right here, you're going to hit next. And then the script that you have to read to the patient is all listed right here. You're going to hand them their clicker right here. I usually have them click it a few times so that they know where they're clicking. So to start, we're going to start with the right eye. I'm going to have you place your chin on the blue side of the chin rest, forehead all the way up. You can use these buttons right here to adjust the pupil to where that blue cross is, or you can also just tap on the blue cross and it will move it. You want to make sure the ring is as close to the patient's eye without touching their eye exactly. So a common mistake with this is getting a ring defect. You can see right here that her pupil's lined up with the blue cross, but you can see the outline of the lens blocking a lot of the screen right here. So usually the fix to that is just moving the lens closer to the eye, and you can see it moving closer. And then now it's evenly spaced around the eye and you can get a good peripheral. And then you'll read off the script to them. So this is going to check for your peripheral vision. You're looking straight ahead at that steady yellow light, pressing the button whenever you see a light flashing anywhere else. Some of the lights will be dim, normally half will be too dim to see. You can blink normally throughout the entire exam. It's going to be about 3 to 6 minutes for each eye. So after that, you'd hit next. And then for the gaze initialization, I like to tell them to keep their eye open just to start for a few seconds. So just to start, I'm going to have you keep your eyes wide open, look straight ahead. And then once you get that green check mark, the gaze initialization is done, and you can start the test. And once the test starts, they can blink normally throughout that. As they're taking the test, you want to make sure their pupil is always centered with that blue cross. You can always move the chin rest up and down here or press it right there. And as she's taking the test, these dots will start to fill up. Once they all fill up, that's when the test is done. Usually when there's like 6 of the dots left, I like to let them know that they're They have about 20 to 30 seconds left. So you can see them start to fill up here. If you press number, it'll show numbers at the spots that are already done. Okay, and then when it says right eye complete, you press OK. You can have the patient sit back, and they'll move their eye patch from the left eye to the right eye. You're just going to hit start left eye, and then you're back to where you were to begin with. Hit next, and you'll repeat the gaze initialization again and have them do the same thing. Chin is going to go on the right side, on the white side of the chin rest this time. Same thing again, you're going to line up the pupil with the blue cross. Can either touch screen or move it with these. So to start, I'm going to have you look at that light in front of you. Try not to blink just for a few seconds. Start gaze initialization. And then once it's checked, you can have them start the test. Okay, so once both eyes are complete, you'll have results here for both. Right now we just have right eye, but if you do both, you'll have the left eye here as well, and it'll bring you to this page. All you're gonna do here is hit save and exit, and you're all done.